Have you ever woken up with that pain that starts in your lower back and feels like a shock running down the back of your leg? A pain that bothers you when sitting, walking, and even when you try to rest in bed? If that sounds familiar, you might be dealing with the well-known sciatic pain. And before you think that the only way out is to live with this torment or even undergo surgery, take a deep breath. Today, I'm going to reveal something that could transform the way you face this issue. If you're over 60 years old, you need to pay even closer attention. Most people believe that stretching the leg or pushing through certain exercises is enough to solve the pain. But the truth is, these methods are often just a temporary fix. They give short-term relief but don't address the root of the problem. It's like trying to dry the floor while the faucet is still running. It works for a few minutes, but soon the problem returns. In this content, I'll show you the real cause of sciatica, the one most patients misunderstand. And I'll guide you through 3 simple and safe exercises, specially designed for people over 60, that truly relieve the pain and help restore your mobility. And at the end, I'll also reveal 3 common mistakes that may be making your condition worse without you even realizing it. Mistakes I see my patients make every day. So stay with me until the end, because that might be exactly when you discover the missing detail you needed to finally feel relief. But before we get to the practical part, let me ask you, how long have you been feeling this pain? Does it come more when you walk, when you're sitting, or even when lying down? Share your experience in the comments. It might help other people going through the same thing. And of course, don't forget to like and subscribe, because this community grows through the sharing of real stories and practical solutions. Many people think that sciatica is simply a problem in the leg. After all, that's where the pain shows up. Burning, electric shocks, tingling, numbness. But that's just the echo of something happening higher up. The root of the problem, in most cases, is in the lower back. Think of the sciatic nerve like a garden hose. It starts at the base of the spine, goes through the gluteal area, down the back of the thighs, and reaches the feet. When it's free, the water, or rather the nerve signals, flows normally. But when something presses on that nerve, it's like someone stepping on the hose. The water doesn't flow, and the pressure causes pain and discomfort. But in people over 60, which may be your case, the scenario is different. A herniated disc can still occur, but more commonly, the causes are conditions related to natural aging, like spinal stenosis, disc degeneration, and arthritis. These changes in the body are as natural as gray hair or wrinkles on the face. They're part of the aging process, but in some cases, that wear and tear reduces the space where the nerve passes through, and that's when the pain begins. Before we talk about the exercises, it's important to highlight something fundamental. There are warning signs that require immediate medical attention. If you experience significant loss of strength in the legs, difficulty controlling your bladder or bowels, or intense pain accompanied by fever, don't wait. Seek emergency care. Now let's talk about the first exercise, which is simple, safe, and can be done in the comfort of your home. It's known as the Z position, because the body ends up looking somewhat like that letter. To do it, you should lie down on a comfortable surface, like a firm bed or a mat. Place a pillow under your head for support, and rest your legs on a chair or sofa so that your knees are slightly above your stomach line. Once you're in position, the next step is simply to relax. Let the weight of your feet rest naturally. Allow your lower back to settle against the surface, and feel how the pressure gradually decreases. This position helps reduce compression in the spine and sciatic nerve, creating space for the pain to go away. The amount of time you can stay in this position depends on your comfort level. It could be 5 minutes, 10, or even 20. If you want to boost the effect, apply a heating pad to your lower back, as heat helps relax the muscles and increases the sensation of relief. One important detail is that if you also suffer from swelling in your legs, this position has the added benefit of improving circulation, since your feet are elevated above your heart. Many patients report that, in addition to feeling pain relief, they also notice their legs feel lighter after a few days of practicing this exercise. After you try the Z position and feel the relief it provides, it's time to move on to an exercise that not only relaxes, but also helps create more space in the joints of the lower back, allowing the nerve to move freely again. This movement is simple but very powerful, and it targets the root cause of the discomfort. Picture yourself sitting on a firm chair, with your feet flat on the floor and slightly apart, in a natural and relaxed position. Lean your body slightly forward and let your hands rest on your knees or thighs, wherever feels comfortable. From there, begin to gently slide your hands down your legs, allowing your upper body to lean forward. Go only as far as your body allows, without forcing it. When you reach your maximum comfort point, stay there for a few seconds, breathing deeply, feeling your lower back open up and the tension fade away. Then slowly return to the starting position, sliding your hands back up along the way. What happens during this exercise is fascinating. When you lean forward, the spaces between the vertebrae open up, allowing the nerves passing through to move more freely. For those dealing with stenosis, arthritis, or natural spine degeneration after 60, this opening is like giving your lower back a breath of fresh air. Many people report that the pain, which used to radiate down the leg, seems to lessen and even shift more toward the lower back. This phenomenon is called centralization, and it's a sign that the movement is working. But pay attention. If you notice that the pain worsens or spreads further down the leg, this exercise may not be the right one for you at that moment. In that case, it's best to stop and consult a specialist before continuing. This type of movement, known as lumbar flexion, is especially valuable for people who feel discomfort or tingling in their legs while walking. It's not uncommon to hear patients say they can only walk for a few minutes before needing to stop due to pain. By doing this exercise regularly, many are able to extend their walks and regain some of the freedom they had lost. For those who enjoy walking, it can be done before, during, and after the activity, working as reinforcement to keep the nerve from being overly compressed. Now that we've learned 2 ways to relieve and create space in the lower back, it's time to strengthen. After all, there's no point in freeing the nerve if the surrounding muscles aren't strong enough to maintain that freedom. The third exercise is focused exactly on that, providing stability to the spine and strength to the body, so that the pain doesn't return easily. To do it, lie on your back on a firm surface, keeping your knees bent and your feet flat on the floor. Place your hands on your thighs, or if you prefer, behind your head for light support. The next step is to gently contract your abdomen, as if trying to pull your belly button toward your spine. This activation of the core, the group of muscles in the central area of the body, will stabilize the lower back. While keeping this contraction, slowly lift your shoulders a few inches off the ground, as if doing a small crunch. You don't need to come up high, just enough to feel your abs working. Hold for 1 second, then slowly return. This simple movement has a powerful effect. It not only strengthens the abdominal muscles, but also improves coordination between the abs and the lower back, creating a kind of natural protective belt. This helps reduce pressure on the nerve and lowers the chances of new pain episodes. If you find it difficult, you can start by just lifting your head and shoulders slightly, without overdoing it. The key is consistency, not intensity. Over the weeks, as your body gains strength, you can safely increase the number of repetitions. Now you already know 3 fundamental practices: the Z position for immediate relief, lumbar flexions to create space and reduce compression, and abdominal strengthening to provide stability and prevent new flare-ups. Together, these techniques form a complete system that works not only on the immediate symptoms, but also on the root cause and future prevention. It's like taking care of a garden. First, you remove the stones that choke the roots, then create space for air and water to circulate, and finally strengthen the soil so the plants can grow healthy. But don't be fooled. Even the right exercises can lose effectiveness if you're making daily mistakes that interfere with the recovery process. Often it's simple, almost invisible habits that end up reinforcing the compression on the sciatic nerve. In the next section, I'm going to reveal 3 common mistakes that, even when unintentional, may be sabotaging your efforts and preventing real improvement from happening. Now that you know the 3 exercises that truly relieve sciatic pain and strengthen your lower back, it's essential to understand something that often goes unnoticed. It's not enough to just do the right things. You also need to avoid the mistakes that sabotage your results. Many people, even with good intentions, end up adopting postures or habits that increase pressure on the nerve and prolong the pain. It's like trying to push a car while someone forgot the handbrake is on. No matter how much effort you make, it's not going anywhere. These mistakes are more common than you might think, and understanding each one can make a big difference in your recovery. The first mistake is believing that keeping a perfectly upright posture at all times is a sign of good health. There's a myth that the more you force your spine to stay straight, the better. But in practice, this rigidity can actually be harmful, especially for people over 60 who already have natural changes in the spine. When you force an excessively upright posture, with your back arched backward, the space between the vertebrae decreases and the pressure on the nerve increases. In other words, the intention is good, but the result is bad. The ideal is to maintain a natural posture, without exaggeration. The body needs balance, not stiffness. Instead of worrying about looking like a statue, allow your spine to find a comfortable position where your lower back isn't under strain. If you usually watch TV, for example, try using a recliner instead of a straight-back chair. The second mistake is believing that walking for long periods is always beneficial. Walking is an excellent activity for the heart, circulation, and even mental health. But when it comes to sciatica in people over 60, too much walking can actually become a problem. That's because prolonged walking requires spinal extension, and that movement can further irritate the compressed nerve. This doesn't mean you should stop walking altogether. It just means you need to respect your body's limits. If you notice that after 10 or 15 minutes of walking the pain increases, that's a clear sign that you need to take breaks. During those breaks, try doing a gentle lumbar flexion, like leaning forward slightly with your hands resting on your thighs. This small adjustment can completely change your walking experience, allowing it to be enjoyable and beneficial without making symptoms worse. Another option is to replace part of your walk with low-impact exercises like pedaling on a stationary bike or using portable pedals while sitting on the couch. The third mistake, perhaps the most delicate one, is resisting the use of assistive devices like canes or walkers when they could provide relief and safety. Many people see these tools as a sign of weakness or aging, but the reality is that they're tools of freedom. Imagine someone who feels pain with every step but refuses help out of pride. The result is that the person walks less, moves less, loses strength, and ends up worsening their condition. On the other hand, those who accept using a cane or walker during a flare-up can stay active, relieve pressure on the lower back, and even reduce the risk of falls. It's not about becoming dependent on them forever. It's about using them when needed as temporary support. Think of these devices like glasses. No one is embarrassed to wear glasses to see better, right? These three mistakes, although they may seem like small details, make a huge difference in your day-to-day life. Forcing an overly straight posture, walking beyond your limit, and rejecting assistive devices are choices that, often without realizing, keep the pain alive and prevent full recovery. When you learn to avoid them, the exercises I've already shown you start to work much faster, because your body begins to work in favor of recovery, not against it. Knowing what to do and what to avoid is already a big step, but true transformation happens when you manage to adapt your lifestyle to keep your spine healthy every single day. Immediate relief is important, of course, but what truly changes your life is prevention. And the good news is that small changes, consistently applied over time, can protect you from new flare-ups and give you much more freedom to walk, move, and live without fear of pain. The first point that deserves attention is body weight. Excess weight acts as a constant load on the lower back, pressing on the intervertebral discs and making it easier for the sciatic nerve to become compressed. Even just a few extra pounds make a difference because the lower back is like a base that supports the whole body. When that base receives extra pressure every day, it naturally wears down faster. This means that taking care of your diet isn't just about appearance, it's a direct investment in spinal health. Choosing balanced meals with quality protein, fiber, fruits, vegetables, and healthy fats helps reduce inflammation in the body and keeps your weight in check. It doesn't have to be a strict or extreme diet, just a sustainable eating pattern that brings both pleasure and health. Another essential factor is strengthening the core, the region that includes the abdomen, lower back, and hips. Often, when we talk about strengthening the core, People only think about having a flat stomach, but in reality, this group of muscles acts like a natural belt that stabilizes the spine. If the core is weak, even simple movements like lifting a bag or stepping up a stair can overload the lower back and trigger pain. When it's strong, those same movements become light and safe. The interesting thing is that you don't need heavy gym workouts to achieve this. In addition, daily posture needs to be constantly monitored. Sitting for long hours, whether at work or at home watching TV, ends up being one of the spine's biggest enemies. When we stay seated for extended periods, the muscles that should support the lower back become too relaxed, and the weight shifts to the vertebrae, increasing compression. That's why specialists recommend frequent breaks. Every 30 minutes, stand up, take a few steps, and do a forward stretch. This can drastically reduce pressure on the nerve. It's also worth investing in chairs with lumbar support, or simply placing a rolled-up towel at the base of your back. This small detail changes the spinal angle and relieves the area. Special care should be taken when lifting weight. Many injuries happen because people bend their spine and lift heavy objects without using their legs for support. The correct way is to bend your knees, keep your spine straight, and use the strength of your legs, which are larger muscles designed to handle load. And never, under any circumstances, twist your body while lifting something heavy. That's one of the most dangerous movements for the spine and can quickly worsen a sciatica flare-up. If the object is too large or difficult to handle, ask for help. Recognizing your body's limits is a sign of wisdom, not weakness. Another habit that directly affects spine health is smoking. In addition to all the well-known damage it causes to the lungs and heart, smoking also impairs blood circulation that nourishes the spinal discs. With less oxygen and fewer nutrients, these discs degenerate faster, losing their ability to absorb impact. This paves the way for herniated discs, spinal stenosis, and ultimately, sciatica. Quitting smoking is one of the best decisions anyone can make, not just for the spine, but for the entire body. We also can't forget about chronic illnesses like diabetes and high blood pressure, which indirectly affect the spine. In the case of diabetes, for example, high blood sugar levels can damage peripheral nerves and worsen sciatica symptoms. Keeping these conditions under control through medical supervision, proper nutrition, and medication when necessary is essential for reducing the risk of complications. Now, speaking more broadly about physical activity, it's important to emphasize that the human body was made to move. A sedentary lifestyle weakens muscles, reduces flexibility, and increases inflammation. This creates the perfect environment for pain to appear and persist. But be careful, not every activity will help. The key is to choose low-impact exercises that strengthen without harming the spine. Short, regular walks, swimming, Pilates, adapted yoga, and stationary biking are excellent options. Movement, when properly guided, is the best medicine against sciatica and premature aging of the spine. Breathing also plays an important role. It may seem like a small detail, but breathing correctly during exercises and even throughout the day helps activate the core, improve oxygen flow, and reduce muscle tension. Inhale through your nose, bringing air to the lower part of your lungs, and exhale through your mouth, gently engaging your abdomen. This simple habit, repeated several times a day, can transform how your body responds to physical effort and even to pain. Another aspect of prevention involves sleep. Getting good sleep is one of the pillars of recovery because it's during rest that the body regenerates. A poor night's sleep not only increases pain perception, but also interferes with muscle recovery. For people with sciatica, sleeping position makes all the difference. Sleeping on your side with a pillow between your knees, or on your back with a pillow under your legs, helps keep the spine aligned and reduces pressure on the nerve. Avoiding mattresses that are too soft or too firm is also important. The ideal is a medium-firm mattress that offers support without being uncomfortable. Lastly, mindset is a factor that's rarely discussed but has a huge impact. Living with chronic pain can lead to anxiety, fear, and even depression. These emotional states intensify pain perception and create a vicious cycle that's hard to break. That's why taking care of your mind is just as important as taking care of your body. Practices like meditation, mindful breathing, Relaxing hobbies and even therapy can help maintain emotional balance, making the recovery process lighter and more effective. And to make this journey even more powerful, I want to hear from you. Write in the comments which of these exercises you plan to try today and how the pain has been affecting your routine. How long have you been living with sciatica? These stories are valuable because they create a support community where each experience helps someone else who may feel alone in their struggle. When we share stories, we realize we're not alone, and there's always a way out. If this content was helpful, remember to leave a like, subscribe to the channel, and turn on the notification bell so you don't miss future videos. That's how you ensure access to reliable information while also supporting this work so it can reach more people. And share this video with someone you know who suffers from sciatic pain. Sometimes a single click can change someone's life by giving them access to information that truly makes a difference. To close, I want to invite you to take this information into your life. Practice it regularly, observe your body's signals, and keep an open mind to always keep learning. And remember, the content I share here is informative and does not replace medical consultation. Every case is unique, and professional guidance is essential for safe treatment. So tell me, what was the biggest lesson you learned today? What change are you committed to making from now on? Write it in the comments, because your answer might be the encouragement someone else needs to take their first step. Together, we can create a wave of support and motivation that transforms lives. Thank you so much for following along this far. If you've made it to the end of this video, it means you've already taken a big step in the right direction. Keep going. Your spine deserves this care, and you deserve to live without pain. Until the next video, and don't forget, your health is in your hands, and every decision matters.